Fibroid, also known as Leomyoma, is a benign tumor arising from the smooth muscle of the uterus. Fibroid is basically a disease of reproductive age, as this is estrogen dependent. Estrogen increases in the obese woman, so it also occurs most commonly in the obese woman. Similarly, COCPs increases the incidence of the fibroids. Uterus is not a straight organ as we see in the pictures. Looking at a lateral view, we can see that the uterus is anteverted and anteflexed on the cervix and on the vagina. There are several types of the fibroid, including those which are present within the uterus, in the cervix, or along the ligaments. The uterine fibroids have further been divided according to the presence within the uterine layers. It may be present in the submucosal, intramural, or subserosal layer. As there are no anatomical confines for the subserosal variety, so it attains a larger size and the patient presents with an abdominal mass, dragging sensation, and no pervaginal bleed. This type may also get adherent to the intestines which are present, and eventually it separates from the uterus and hence it becomes a parasitic fibroid. The submucosal variety, under the effect of the gravity, hangs downward through the cervix into the vagina, which bleeds during the intercourse, that is, the postcoital bleed. This also may undergo torsion in some cases. Cervical fibroid does not have the submucosal variety. Besides, it has the subserosal and the intramural variety. The subserosal variety may press along the ureter, hence causing the urinary retention symptoms. Now, the last type which is left is the interligamentary one. The interligamentary fibroids may be present along the ovarian ligament, broad ligament, or round ligament. Fibroids are investigated through ultrasonography if the fibroid is present within the uterus. Laparoscopy is also performed if the ultrasound is not successful. Hysterosalpingogram, CT, and MRI are also performed in some conditions. Fibroids are treated medically or surgically. The medical treatment involves blocking the estrogen, as fibroid is an estrogen-dependent disease. GnRH analog would do the same. Danazol and NSAIDs are also given in some conditions. Surgical treatment involves according to the age of the patient. If it's a young patient, then myomectomy is done. In case of an older patient, removing the uterus is a preferable treatment, which is hysterectomy. With the advancement in science and technology, it is now possible to weather off the fibroid non-surgically through cutting the blood supply with the uterine artery embolization.